Do you have pain or a burning sensation when you urinate? You just might have a urinary tract infection. Hello guys, welcome to my YouTube channel. It's your girl Soft Life Duck. If you're new here, welcome. As you can tell from the beginning of the video, our topic for today is urinary tract infection. What are urinary tract infections? Urinary tract infections occur when bacteria enter into the urinary tract and cause an infection. I'll be sure to put a diagram somewhere in the video so I can explain to you, or so you can kind of understand what the urinary tract looks like. It has the kidney, it has the bladder, it has the ureter, it has the urethra. So when I put the diagrams, you can kind of, when I mention names, you can kind of like just tell. What does the urinary tract do? The urinary tract forms urine, the urine that we know, and then it helps us pass this urine out of the body. Do we understand? That's the simplest way to put it so you can get it. And this is a very popular condition for children, adults, and for the elderly population as well, and that's why I think everyone should know about this. The infection can affect any part of the urinary tract. If it affects the bladder, it's called a cystitis. If it affects the kidney, it's called a pyelonephritis. And depending on what part of the urinary tract is affected, it can also give off like characteristic symptoms. We'll be talking about that in the later parts of the video. Now let's talk about the risk factors. These are factors that increase one's chances of getting the urinary tract infection. Some people at higher risk of getting the urinary tract infection, like the females. Females are more likely to get the urinary tract infection because the urethra, which is a part of the urinary tract, is shorter in females and also closer to the rectum. So the rectum is close to the anus. And if the urethra is closer to this part of the body, obviously there's going to be bacteria from there that's going to get into the urethra, and that increases the chances of females getting the urinary tract infection. And that's why it's advisable that for the females, when you wipe after going to the toilet, when you wipe, you have to wipe from front to back and not back to front. There are other factors that can increase one's chances of getting a UTI. These are a previous urinary tract infection, yeah, sexual activity, yes, changes in the bacteria that live in the vagina or vaginal flora. There are bacteria that live in the vagina and they're there to actually protect your vagina from having infections. Pregnancy can increase one's chances of getting a UTI. Structural changes like people with enlarged prostates, yeah. Age, the elderly population, and also young children are more likely to get a urinary tract infection. Poor hygiene, for example, in children who are getting the potty training. Since we've covered the risk factors, let's move over to the symptoms. Symptoms can include pain or a burning sensation while urinating, frequent urination. This is more frequent than normal. In the need to urinate despite having an empty bladder. Pressure or cramping in the groin or lower abdomen. Yeah, there could also be pain in the lower back, right here, this side, because your kidneys are located there. A person could also have fever, chills, nausea, vomiting. Yeah, this is symptoms. They may seem like general symptoms, but then you'd also have like symptoms suggesting a urinary tract infection, and that's where urination comes in. Remember, we said children are more likely to get urinary tract infections. The problem here is, since they're so small and probably unable to like articulate their symptoms properly, as parents or caregivers, we should be able to tell when something is wrong with a child. So if you notice that something is wrong, just take them to like a medical professional, and after doing like a series of tests and physical examinations, they'll be able to explain to you if the child has a urinary tract infection. When do you seek medical help? If you have any of the symptoms I've listed, please be sure to go see a doctor. They'll most probably prescribe antibiotics to you. You could take them at home, but if the case is very severe, you might be admitted in the hospital and giving your treatments in the hospital. Now, let's talk about your treatment options. The snag is UTI symptoms can be similar to sexually transmitted disease symptoms. This is where your doctor comes into the picture. They have to do physical examinations, they have to do urine tests, most probably blood tests, to determine if you've actually got a UTI or a sexually transmitted disease before they can administer treatment to you. So please do not self-prescribe your antibiotics. Bacteria cause urinary tract infections, and for this reason you'd be given antibiotics. Make sure you use them as prescribed by the doctor. Make sure you do not share your antibiotics with someone else. Make sure you do not save your antibiotics for the future. Please complete your dosage and don't save for future occurrences. If you have such a symptom again, please go to the doctor. Please and please. The reason why it's important to get urine tests done before starting your antibiotics is they need to determine what bacteria is causing your infection, so they know exactly what antibiotic to prescribe to you. And in future, in case you have a urinary tract infection again, they can also tell if it's from the same bacteria or it's a different bacteria. You might feel like these things are not important, but they actually do matter, and they're there to like protect you. How do you prevent yourself from having urinary tract infections? Stay well hydrated. Drink a lot of water. I'm also guilty because I do not drink as much water as is required, but please try to drink enough water. Urinate after sexual activity. Take showers instead of baths. Minimize douching, sprays, or using all sorts in the vaginal area. Like I said, there are bacteria that live down there. So if you use soap and water, you're going to kill off all of that bacteria and you're more likely to get infections, okay? Teach girls when potty training to wipe from front to back, and if you're an adult or adolescent and you're guilty of wiping from back to front, please change and wipe from front to back. This brings me to the end of the video. It's a very short one. I hope you've been able to learn something from this video. If you've got any questions, please don't forget to leave it in the comment section. I'll be sure to respond immediately I say. Don't forget to subscribe, hit the like button, don't forget to share. I'll see you in my next one. Bye.